Since I was in my teens, although I didn't recognise it at the time.
When you come into this group, and the reason I chose to come to it is because
I basically stopped functioning and totally went down. I came there unfair, right?
Split my mum and dad up, and they were together from my mum was about 14, 15. When I was younger, from up till about 12, my childhood, great. Mum and dad was great. My dad used to take us away runs in the country park and everything, and they were close. But my dad went another way, and he went down, it was the drink way at first. So as we were still in the same bit where we stayed in the house in Whitlets, so it built up for there, and then my dad went from there on to another substance of drugs. When I started to use drugs was when the time my dad had brought it into the family, and my ex-partner was actually, ex-partner as I can go along, was actually going out with my dad every day and hiding it behind my back. And then we used to have big fights and everything because I could catch him out. I wasn't stupid, I knew there was something wrong. And then it was, I used to get, actually, I got a kicking. I actually got assaulted from my ex-partner for not taking it in front of his friends. And I can remember it was one Christmas, because my Christmas tree and everything got burnt. And I had to actually go out a window. But then in the end up, I thought, I started taking it. The stupidest thing I've ever done in my life is taking it. Started taking it with my ex-partner, and then that was it. The lowest point in my life has been my dad bringing the heroin into the family. Yep. Because it basically broke the family up. Split my mum and dad up. They were together for my mum was about 14, 15, and her mum actually passed away when she was young. When my mum was 15, I think it was, when my mum passed away, so she was on her own, so it was just like my dad's family she had. So he broke everything up, and then I blame him. It's not that I can blame him, but if he hadn't have brought it near us, I wouldn't have known anything about it. And if the ex-partner, I picked the wrong ones, I always do. That's why I've been single for 2.5 years. The ex-partner, he was on it. And it's just been that's the lowest time in my life, is my dad bringing it in and ruining the full family. The best thing that ever happened to me was, went to the doctor, and he had been, I've been going to him for a good couple of sessions, and he actually suggested, right, you need help. So he put me through to clear an occupational therapist. And it's the best thing that's ever happened to me.
Lisa was referred to me by our consultant psychiatrist, who wanted me to predominantly look at her low mood and her issues around anxiety and low self-esteem. And there's been a whole lot of work that we've done over that time. At the very beginning, I wanted to sit down with Lisa and I wanted to hear really about where she was coming from and what had happened to her in the past, wanted to get her story, and that's something that as allied health professionals is very important to us, to get where the client's coming from and where they want to be. We'd spent a lot of time talking about things that had affected her in her past, and think why she had chosen the path to use substances. I guess a lot of our clients use substances in order to cope with things that have happened to them in the past, or to block out particular emotions that they don't want to really think about.
Every week I see Claire, and sometimes she'll phone me as well during the week to make sure I'm okay. And now it's a stress diary I keep, and it's just what happens on that day. I write everything down on it.
What I wanted to try and get Lisa to the point of was where she could try and self-manage her anxiety. For example, her anxiety was taking over her lifestyle really, and was preventing her from going out. And so in order to give her sort of more information about her anxiety, coping strategies towards her anxiety, that helped her to be able to self-manage that. And it's very much, going along those lines with all aspects of her life, and so that she can work towards her recovery and be able to self-manage, and that's what as allied health professions we're good at.
The supported self-management, it's crucial the word supported is in there, because it's not about doing it on your own, and the case example, or the service user example with Lisa involved in it, really articulates that ability to work in partnership with the service user and with the therapist, and that supported towards self-management, so you're not doing it on your own, in that very practical way of being with somebody and going out.
I started being able to get myself out, motivation to get myself out. I'm actually now in with someone else, it's my lady Julie, that's a dance movement therapist. So I'm doing that every Monday. Managed to get me to, so I wasn't sitting about the house, getting me actually to walk up the town, which I could never ever do. I couldn't walk up the town. I was so anxious that someone was just going to attack me because I was bad. Because of all the attacks I got for the ex-partners, it's just always in the head. But Claire was just, it's as though someone upstairs has just said there that the girl, she needs help. She's went this far, I've come away from it, went this far, and I just needed the help.
In the Ayrshire Arm, we've got a lot of allied health professionals working alongside us. In addictions, we have access to physiotherapists if we want to, where we can refer on to them. And I think that's important for looking at people's levels of activities. And there's other people within the leisure facilities that we can then refer on to as well. I also referred Lisa on to one of the allied health professionals as a dance movement psychotherapist. We've got a student working with me just now, and I've referred Lisa on to do a little bit of work looking from a psychodynamic approach, really about using movement in order to link in some of the psychological trauma that she's had in the past.
I think listening to patients' stories, it's really obvious how much value they place on the role that allied health professionals have had in supporting them on their journey. I think where AHPs need to do a little bit more work is being able to articulate those messages about the impact that they have. And a big part of that is about professional leadership, helping people to recognise that what they're doing in practice is helping to deliver the aspirations of policy for mental health and for dementia, for rehabilitation and enablement, and in particular long-term condition management.
What Claire's also done as well is made me think, open me up to other people, like speaking to other people, like as yourself. I could never ever have done anything like this in my life, never. But since I've had Claire, so it's like, I don't know, like my dad being what he was, he's still my dad, but they all come to me, and I take a lot of their pressures. I take pressures from my sister. My sister's been through a lot. I take all the pressures of everyone, but Claire says to me, Lisa, you've got to now think about yourself. It's yourself now you think about, and now it's myself I'm thinking about. And I just can, like, I was speaking to someone up at the bar at the minute ago, which I could never have done, is went up and spoke to someone freely.
The best work I feel is done is probably when we're out doing something with our clients, and it might be that we go into town, and that would be working on people's anxiety and trying to build up their confidence in that environment. We might go to a leisure centre whereby it would be promoting activity and looking at exercise and the importance of that and how that has a positive impact on their mood. It might be that we go to, if there's household management issues or that they need to work on their environment, it might be that we go to, we go to a place to buy things that they need to make their lifestyle a wee bit better. Also, with a couple of my clients, I've also gone to the great outdoors to get that fresh air, to go walking even, which builds up the adrenaline, which is giving them, that energy to focus on where they want to be. I've done a couple of sessions walking along the beach with people because they can't go into busy environments. There's been a lot of work outside, which has been really positive, and that's the kind of things our clients give us feedback on. They love to have that opportunity.
Claire has also made me more aware of, like, for instance, as I was standing up there at the area up there, I was taking pictures of the lovely place that's in front of me. She's made me more aware of what's around, like walking over the bridge. I would never think of looking in at the water or looking about over the countryside. I would never ever thought of doing things like that, but now I do. And I was standing up there just about 10 minutes ago taking pictures of the lovely scenery that's round about, and it's something that I would never ever have been. Like years if you'd have known me years ago, I would have been as thin as I was, about a size 6, thin and bone, and now it's just a totally different person, and it's all thanks to Claire through her help.
Psychological therapy is very much integrated into part of what we do, and the day-to-day running of when we meet up with clients, it's talking about what's happened to them in the past or what is important to them to be able to move forward.
It's the best thing that's ever happened to me, because I used to just lie in my house, just didn't want to get out of the house. I'd be in my pyjamas, just lying on the couch. I wouldn't go out. I wouldn't get dressed, anything like this. I wouldn't put makeup on, I wouldn't do my hair. I was finding it hard, wouldn't go in baths or anything. Then I get Claire, and Claire has actually changed my life.
If you were to ask Lisa how important her relationship is with me, I think she would be very, very positive about that. Frequently Lisa tells me how much I'm there to support her, how I sit and I listen to her, how we're able to go out and about and do things. I think a lot of that has had a very positive impact on our mental health.
As the Chief Health Professions Officer, I work really closely with the HP directors and NHS boards and the HP leads for mental health, and they are going to be absolutely key to delivering the strategy and to playing a part in influencing local delivery plans, not just in mental health but across all the areas of health and well-being, but in particular delivering on the AHP action plan.
When it came to that point of deciding on my career pathway, being an allied health professional was obvious to me, because it was about helping people to be independent and to self-manage their own problems and to work towards the recovery. And that's very much, where I come from, and that's what I do with people.
I hope that this document energises people, helps them to be excited and inspired about what they can deliver, and helps us to realise and translate policy aspirations into changes in everyday clinical practice.
The Allied Health Profession Strategy, we hope, will bring us all together as allied health professionals, instead of working perhaps in our own little bubble as an OT or as a speech and language therapist. And surely together then we can provide a much better quality of service for the client, and it will have much more positive results.
What I really hope for the HPs to do, I think the main thing is to work in partnership, and that partnership is with each other, with service users and with other HPs that work in physical health and social care, and also the third sector, so that ability to work together.
My future is looking really, really, it's bright as the sun, because I have been given a brand new house. I'm actually getting upset, babe. It's taken me away from the area that I was in. That everyone was coming and chatting the window, and it was all people I didn't want to see. But now I've got a house that's just been built, and everything in it has just been built newly fresh, and it's for me just to walk straight into. And that's me.